Hey, smart chiropractors, and welcome to Clinical Conversations. I'm Dr. Jeff Langmaid here with Dr. Jason Deitch, part of your smart chiropractor team, and we have a special guest today. Dr. Jason Markle is tuning in from Colorado. If you have questions, drop them down below. Dr. Markle is somebody we've come to know over the last year, and we wanted to bring his story, his unique view of healthcare to you. So we're going to ask our favorite questions. We're going to encourage you to ask yours down in the comments. Dr. Markle, thanks for taking some time today. How are you doing?
Doing well. Thanks for having me, Jeff and Jason.
You got it. So I'm going to trace it back. I love to start with this question. I'm going to trace it back to many moons ago when you decided to get involved with healthcare and become a doc, become a physician. What's that origin story? How did you first get interested in going into healthcare, and what kickstarted that journey for you?
Yeah, it does go back quite a bit. Back to high school and college days, I never even wanted to be a doctor to begin with. Early on, I was in sports medicine. I was an athletic trainer in college, and then went down that route. And then one of our team physicians, I went to Florida State University in Tallahassee. Dr. Showers, who's the head team doctor, he's also the personal doctor, Dr. Bobby Bowden, and he's like another doctor, really good athletes from Florida State. But he actually got me introduced to the idea of doing like orthopedics and non-surgical orthopedics type stuff outside of when I finished college. And that got me going probably my junior, senior year of college. And then I started getting more involved and started reading like, well, okay, what do I want to do? And that's right around the time a lot of the literature started coming out with PRP, holotherapy, some of these regenerative techniques. So I went down that rabbit hole and found that osteopathic, so I'm an osteopath, DO by training. DO schools teach holotherapy, some manipulation, and some more of the regenerative, natural type of medicine. So that sort of appealed to me. Being from Florida, there was a great school in Florida called Nova Southeastern. So my junior year and senior year of college, I was like, oh, that's sort of like the direction I'm going to take it, and sort of went full board that way. Went to DO school. Eventually, that's like, oh, now you have to take a specialty. And then looking at some of the non-regenerative stuff, Centeno-Schultz started popping up with some of their research and papers being studied, published about stem cells and PRP. And so Dr. Centeno is a PM&R doctor, physical medicine rehab doc. So I was like, well, that's sort of how I want to take my career and sort of treat patients. Because it's really from a functional medicine, holistic view, it's a better way to treat patients, just ideology-wise. Versus surgery, some of the other routes, because I've also had surgery in med school. I had my scaphoid fracture treated, and now I've got some post-traumatic arthritis and things like that. And I was also an athlete in college, so it's like, is there a better way to keep people healthy, active? So that sort of appealed to me. Fast forward 4 years of med school, I went into PM&R, and then I actually got Centeno-Schultz started a fellowship program, lo and behold. And I was second or third fellow in our program here. And then luckily I was the short straw in the pile to be able to come out here, get pretty well trained, and been out here jamming ever since.
You know, I'd like to ask you some more on that, Dr. Markle. You sort of touched on it, and I'd love to go deeper. Historically, there's sort of been this, Coke or Pepsi type war, is it medicine or chiropractic? That you have to choose one or the other. And I think, you from the inside, from your experience, seeing on the medical side, sort of swinging the pendulum over because you've seen what you've seen, you understand the way most traditional, also orthopedists think. Help us understand, what attracted you to, more of this holistic or natural or, I guess, focus on helping the body heal itself on its maximum ability before you just start referring out, for surgeries or injecting with steroids just to relieve the pain temporarily with an expense of, perhaps accelerated regeneration and so on. Help chiropractors understand your thinking, being that you are trained as a traditional medical doctor and an osteopath and so on. Help them understand, how do you see it? From most chiropractors' perspective, most medical doctors have learned, listen, let's just medicate it, let's reduce the symptom, and we've got to cut it or burn it or whatever it is. There seems to be this sort of mindset gap. What excites Jeff and I so much about working with you and all the doctors is the Centeno-Schultz clinic is that you think more like us than sort of the traditional, drug and cut and surgery. How people get an insight as to sort of, what inspired you to sort of go that direction as opposed to more drugs, more surgery?
Yeah, so the ideology behind me started medicine, all this was more a functional medicine kind of position. But as I went through and matriculated through school, the residency program, medicine, allopathic medicine is all reactive medicine. So disease comes, you got diabetes, okay, I've got medicine for X, Y, and Z. You got X symptom, well, I've got this medicine for that symptom, or that injection, or that surgery for that, versus reverse engineering it. It's like, okay, this is what's going on, but how do you start there and being more proactive long-term wise and sort of reinventing the wheel? Like, hey, we work backwards and be more preventative on future, not only dealing with what we're dealing with right now. And then long-term wise, it's just a better way to treat patients that way. And that's a lot of the osteopathic and chiropractic mindset. I've worked a lot with chiropractic schools down in Florida. So on time with chiropractors working on spine, that's when they start talking about ligaments, tendons, and spine pathology and what causes it and how things can start declining and then long-term wise maintenance kind of thing. So it flips the pendulum where it's like, okay, yes, this is what you got going on. It's not just, okay, you go from A to B, but let's reverse engineer it. Like, okay, how do you start this and can we address that in addition to treating symptoms?
I think that's awesome. Thanks for explaining that. The pathways and how similar I think the pathways are with what you guys do and what many chiropractors out there do day in and day out is so similar. And I guess my number one question for you regarding, and you mentioned this a couple times, you've been going through with regenerative and orthobiologics and stem cells and PRP. These can be hot button topics, right? Where docs are sitting there, is it real? Is it not real? What the misconceptions are so great about all of it. I guess, there's a lot there that we can dive into, but if you had to break down maybe the biggest misconception in the regenerative healthcare space and with what you do day in and day out, whether it's specifically related to a technique, whether it's specifically related to a patient type, or anything that you can think of, what's one of those biggest misconceptions you think that are out there amongst other providers with their understanding of what you guys do?
Yeah, most providers, most patients think about what we do, those terms, stem cells, PRP, regenerative medicine, all those leads to the conclusion like, hey, it's a one-size-fits-all where it's a magic pill. You give them this, it's going to fix all and cure all. We're a little bit different. We're a much social doctor first. We can examine you. We've got a lot of tools in our tool belt, and there's certain indications for those tools and what can and can't be done. So some people come to me with an ACL tear. Well, we can treat that, and sometimes we can heal that with regenerative treatment. Some people have regenerative disc disease. Well, we can't cure it, but we can help it, along with some other providers to help maintain lifestyle. So it's all about pain and functionality for number one. So yes, it looks bad. Yes, you have meniscus tear, but let's dive into it and then figure out, like, okay, yes, everybody has meniscus tear. Why is this one symptomatic? So we can treat that. It all depends on what's going on and catering it to the tools we have. First of all, medicine was like, okay, not everybody needs therapy, not everybody needs stem cells. So we're focused on really coming up with an understanding of underlying and accurate diagnosis. And then we can start talking about options in the treatment and expectations, like what do I expect we can help and what we can't help, and even if we can't help it, is it really going to limit your function and your pain long-term wise?
I'd love to follow up a little bit deeper on that as well, because our hope in doing this program is several, just for viewers who may be tuning in a little bit late. One is to sort of dispel the myths that you brought up. There's a lot of, like chiropractic, there's a lot of confusion. What is it? What is it for? Who really does what? What are those details? So, Jason, can you go into more detail about, there's chiropractors that mention stem cells and PRP and regenerative medicine, and there's confusion. Is that the same thing you do, or how is it different? Can you break down so it's so different from a chiropractor providing these types of, or offering these types of services, and the way you do what you do in your practice, and how they're extremely different, even though they may have the same name?
Yeah, so first of all, you have to understand about when someone says stem cell therapy or regenerative treatment, what are they talking about? Is it from you, meaning autologous, or is it from somebody else, another source? All those other sources, you've got amniotic membrane, water jelly, certain amniotic products. So you've tested all that stuff to figure out, well, what's in it. Because everyone claims stem cells, it's regenerative, or what's in it. We tested all that stuff, and there's basically no living viable stem cells in it. It's watered down growth factors, essentially watered down PRP. It can be beneficial from a biologic standpoint. It's biologically active, but there's no visible and living stem cells in it. And then, how do you use those tools? So it's like, okay, someone has myocarditis. Do you just blindly inject it nilly-willy, or do you use more of an image guidance, precise guided injection to really get that outcome? So there's a lot of chiropractors, PAs, a lot of physicians have that as well. They do a lot of this stuff, but they don't do it well. So then you start working on the details. Okay, well, how do you do it well? Well, you examine and figure out where to put it, and then you use some sort of guidance to make sure you put it directly where it needs to go. If someone's blindly injecting, and there's lots of research out there that says blind injections 90% of the time don't get where the physician's ultimately trying to get it. Steroid injections are like a hand grenade, close to good enough. So over the last decade, you put it close to the joint, it's going to get some sort of biologic action, shutting everything down. But with biologics, it really needs to be precisely placed into the pathologic tissue. From our label there, just injecting into gluten muscle with a 1.5 inch needle, essentially trigger point injection, versus using an ultrasound with X-ray confirmation, make sure you're in the right spot. It may help some patients, but it's not going to help most patients. Versus us, there's some patients we can't help, but we help most patients.
I'm like it's sort of a personal trainer going, I can stretch you and make the same sounds a chiropractor makes when they do what they do. So it's sort of presented as similar. You didn't know any better, you go, well, they made a sound, and they made a sound, it must be the same. But if you are a chiropractor, you know there's a lot more study, a lot more intention, a lot more specificity, technique that goes into caring for a patient than just, wow, look, I made a noise. I sort of make that same metaphor with what you guys do is, I don't know how to say it, the copycats, the wannabes will go, oh, look, see, we put a needle in and something goes in your body. If you don't know any better, you don't know any better. But what I think you're saying, what I know just for chiropractors to really dig deeper and understand is the level of your training, number one, is significantly higher than, I'll say, even any other medical specialist out there doing any of these types of orthobiologic procedures. Two, you mentioned, and people should understand, chiropractors understand that you guys specifically work with in-house laboratories in the practice. And that's not just to be cool and say we got a lab. It's to do what you just said. It's really personalize the treatment, the care, literally personalize the concentration of orthobiologics based on each individual person. Chiropractors love specificity, and that's one of the things you guys really focus on that differentiates you from others. And the third that I want to make sure everybody understands is what you mentioned, which is the idea of not just blindly injecting whatever, wherever, but in fact having under image guidance the ability to, in real time, see where the needle's going so that the right subject is exactly the right place at the right time. And again, if you don't know any better or what's the saying, chiropractors always get that criticism. I went to the chiropractor, like one side of it, the other side pops, and now it's an oversimplification of the reality of what it really takes to provide these services. And for chiropractors, it's good for them to understand the same type of nuances. I don't want to hijack the whole thing, but I want to make sure that people understand you are well experienced with, I'll call them, co-managing patients, whether it's people that have come to you, aren't ready for whatever procedures you have, maybe it's not bad enough, or maybe it's too bad. You actively refer out. When those people that come to you, they're not yet ready for your procedures, you refer to chiropractors. And when chiropractors and patients that just don't seem to be sort of getting out of those chronic pain patterns, they're not responding to care the way that the chiropractor believes, and there may be more going on. Instead of going, hey, go to a surgeon, oftentimes chiropractors will send them your way. Can you sort of break down, what it looks like for chiropractors to sort of co-manage with you? Who is it best to send people to you for? Who is it not best to send people to you for? And who do you send people to chiropractors to get care for also? So we can just sort of get a kind of high-level picture of what is together really look like.
Yeah, we have a great relationship with a lot of the local chiropractors, and most of the guys I work with and gals. It's usually a give and take. Usually, I see a patient and they're just super sensitized. Like, hey, their spine is so neuromuscularly inhibited and sensitized. It's like, if I put a needle on that, there's no way we're going to have a good clinical outcome. Versus if I send them to the chiropractor, they can do some simple neuromodulation, they can do some desensitization techniques, some gentle techniques, calm everything down, get them pretty good. Sometimes that's all we need. And then, okay, we're better, and not where we want to be, then they send them back and they think, okay, they're pretty tuned up, then we can have the best clinical outcome. And then opposite, if chiropractor has someone who's more just, we're adjusting them weekly, we're getting some good temporary relief, that means, okay, they're unstable, and we're able to restabilize them, but everything's just not holding. Well, that's sort of where we come in, where we can treat some of those underlying issues, such as ligament laxity, supraspinous, semispinous, lumbar ligaments, to help maximize chiropractor manipulation, things along those lines. Or if someone just has like a disc injury, they're like, okay, all the manipulation I'm doing is just aggravating things. Well, we can treat that disc injury and try to heal the disc, and additionally stabilize it, and then send it back for neuromuscular rehabilitation, a general maintenance program, long-term wise, just to keep them pretty active and functional after that point. So there's definitely times where we give and take from chiropractors, where they do a lot of things I don't do, and I do a lot of things that they don't have the ability to do. So we definitely co-manage a lot of patients. And if the sort of marriage there sort of works pretty well, and most of the chiropractors and handful of them that I work with locally, I treat them as well. So all of them have issues, and they usually, if their colleagues aren't able to help them, they come to me, I treat them, and vice versa. I'm standing with 20-pound lead vest all day, my spine is a mess. I usually go to be adjusted every so often, just keep myself in pretty high functionality. So it works both ways.
That's awesome, and I want to encourage everybody watching. We'll drop the link down below, but you can check out the Smart Care Network, and on that page has a Centeno-Schultz clinic, which is where Dr. Markle is located, and all of their contact information as well. That's the smartcarenetwork.com. We'll drop that below. But I'd love to talk disc and ligament, but I'm going to peel it back one layer before that, Dr. Markle, and I'd love for you just to talk through sort of your workup process. When a patient comes in and sees you, I think it's great to learn these kind of clinical pearls that others are doing when they go through an evaluation process. So in a general sense, can you just talk through a patient journey in your practice, what that evaluation looks like? How do you make a clinical decision right before they get to that point of receiving the care from you?
Sure. So we see people from all walks of life, all over the world, as well as local patients, and everything from head to toe, from big toe, NDP arthritis, low back pain, neck pain, knee pain. Commonly, we see a lot of knee arthritis. People come to us like, hey, I don't want my knee replaced. We do a pretty in-depth evaluation where we're looking at the full kinetic chain from a lumbar spine to the pelvis, hip, knee, ankle, functionality. So we'll put them through a full dynamic examination where we're evaluating all those things, sensory testing, motor testing, neuromuscular recruitment. It's like, okay, if someone can't stand on a single leg stance and their glute med is shutting off and that Trendelenburg is continuously not firing, as well as their core muscles or transverse abdominal from a core perspective and firing, and we've got some MCL instability, meaning they've got a lot of valgus strain going on in the knee from a muscular control. It's probably coming upstream. So probably L5S1. So it's a lot of patients I'll talk to them about this stuff, and they'll come for a knee, but all of a sudden I'm evaluating their back and the hip and all these other issues. We find all these small little accumulation of issues, ankle instability combined with lumbar radiculitis, low level. But they're like, oh yeah, my big toe goes numb every once in a while if I drive for a long time. It's like, okay, let's take a look at that. So we're treating neuromuscular pathways, overall stability, and then the articulation in combination, and then sending them afterwards from a rehab standpoint to sort of get everything re-educated, as well as realignment. So it's very much holistic in that sense, as well as we're diving into some of their dietary habits, some of their lifestyle modifications. Like there's a lot of patients come to me, they're overweight, diabetic, everything's from a medical standpoint, they're just metabolic syndrome to the 9th degree. It's like I can inject stem cells all I want, but you're not going to get that much benefit if we're not taking care of the underlying issue, which is the whole post that we're putting in it, right? So every journey is a little bit different on every patient, and no treatment is exactly identical. Someone has X, Y, or Z going on just because they have the same symptoms, they have different causes. So we're tailor-making what we're doing, what we're seeing. So usually I spend about an hour with my patients that first visit. With most, which is unheard of in most medical practices, most docs see 30 to 50 patients a day. I see maybe 10 to 12 from a procedural evaluation standpoint. So that's pretty unique in our practice, where you spend the time, figure out what's going on, and educate the patient, and then really send them off to the appropriate location. You're not ready for them yet, go X, Y, or Z. It's like, yeah, let's do something, and then go to X, Y, or Z for like a rehab perspective.
You know, one of the things I'm always so impressed with, all of you that are in Centeno-Schultz clinic is oftentimes, to me, it sounds like I'm listening to a really smart chiropractor. And I mean that obviously with, as a compliment, but also because you're really speaking our language. You're talking about, really understanding not just treating the local symptom, but looking at the kinetic chain. You're talking about not just, helping somebody feel better, but finding and correcting the cause. You're talking about how many of these issues in orthopedics are related to, in your words, stability, in our words, misalignment. In ways they're synonyms and sort of heads or tails of the same thing. And really what's, about the only thing different from my perspective of what I've watched now with you and the other doctors there is the actual almost technique of addressing what does appear to be the same thing from all of us. You see instability and you use injections to create more stability. We see misalignment. We try to put motion into a joint in order to be able to restore the movement and motion. But ultimately, what's great is that we're really looking at the body with a sort of similar model. It's designed to heal itself. When it doesn't heal itself, the goal is to figure out what's healing or inhibiting it from healing itself. That story is sort of the same story from both of our sides. With all that said, I'd like to go back into, for those chiropractors that go, wait, you're an osteopath, you're like me, if I have patients that otherwise are going to surgery, I can send them to you. How does that work? Let's talk, both, there's lots of chiropractors in called the Denver area, of course. There's national chiropractors that may not be local. I know there's a difference when you talk to and text with, email with chiropractors directly. If they've got questions or want to ask you, this might be an appropriate candidate or case. We'll leave your contact information down below. But help chiropractors understand, maybe reaching out to you, or I know Sarah is your patient coordinator. How should they navigate, how to move forward if they've got somebody that might be interested in working?
Yeah, if someone has any medical question, my contact, I'm happy to answer and ask any questions they have. So if someone just like, hey, I've got this patient X, Y, or Z, do a little curbside, they can always call me directly or text me or email me, and then we can get together and figure out what's going on. If they have a patient with a known diagnosis, this is what it is, want to see if it's evaluation, I'm still a good contact myself, but Sarah's a good mediator as well. If someone's like, hey, when we start talking like, yes, it is a good fit, like this is something we likely can treat, then sending the patient contact information to Sarah so she can sort of put those motions in place where we can get the patient sort of evaluated and go from there. But just from a doc-to-doc standpoint, I prefer that direct communication. It's like, hey Jace, we got X, Y, Z going on. I got this patient. Can you help? We get a little bit more info on them, and then we'll give them a little, like, yeah, that's something we can help. Or it's like, no, this is what they should be doing, or just keep on what you're doing. That's usually how our local, as well as other patients, got a couple of chiropractors from West Virginia, North Carolina. They sort of send in patients, and I treat them as well. They fly out, and they do that all the time. So every week I'm phoning a couple of different places, figuring out, like, hey, can you help this patient or not? So that direct communication is always key.
I actually got fitted up before you go. Are there common injuries you find amongst chiropractors? I hear what you're saying. Chiropractors applying them from across the country to save their own careers. Are there common issues that you see amongst chiropractors in terms of chiropractors
in their practice? Some people nowadays are doing a lot of myofascial release, manual therapy, so their thumbs, elbows, shoulders get a lot of extra use in it, and then just their backs, their neck and backs. They're sort of like us, they're hunched over, terrible posture, and just adjusting all day long, and their bodies just can't handle the loads. And some are seeing like high volume of patients 6 days a week, and it catches up to you in that upper 40s, 50s, start catching up to you.
Let me ask you one more question. What are some of the favorite things that you love to take care of? I know you guys take care of people, kind of head to toe, but what are those things that you just personally love taking care of? What are those diagnoses, those body regions that you love?
Yeah, spine conditions. Treating spine can give someone the most functionality out of most joints we treat. Anybody can live their life with a bad shoulder. There's some shoulder pain, some knee pain here and there, but spine is the debilitating issue that just wreaks havoc on patients' lives. So if they have disc injuries, that's something we can treat quite well and get them pretty functional to the point where they can live their life. And that's one of the biggest things we see. And then the things that patients are like, hey, I'm having a fusion. Can you treat this patient and avoid a big surgery? Those are patients that's like, yeah, we can typically help quite a bit with something quite minimally invasive and a shorter recovery time. If we just look at ACL tears, I can probably treat 70% of all the ACL tears out there. Those are technically a challenging procedure. We sort of invented that. And we can see before and after images where we can heal an ACL without surgery. And long-term wise, if I see a 15-year-old and able to treat them, that prevents them from having knee replacement in their like 30s, 40s. So things like that, they're like life-changing, pretty profound results. Just from a functionality standpoint, those are the things we like to see.
Dr. Markle, we could go hours and hours, and we won't do that today, but we will have you back on. We really appreciate you coming on, talking down your history of what got you involved in medicine, what you guys do, and your unique vision of healthcare. I think the parallels, and it's so complementary to what we do as chiropractors. I'm going to encourage every chiropractor out there, if you yourself or a patient has had a recommendation for surgery, make sure you're getting that second opinion. Smart Care Network is where you can find all of Dr. Markle and the Centeno-Schultz doctors' information. We'll drop that down below. Dr. Markle, thank you so much for coming on. Have an awesome day with the rest of your patients. We'll look forward to catching up with you in the not too distant future because there's a lot of questions that I still have for you. So thanks for doing what you do. Thanks for coming on, and we'll talk to you soon. Hey, if you like that video, be sure to subscribe to The Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.